Hepatitis E virus, HEV, is the most common cause of acute viral hepatitis in China. Recently, a shift in molecular epidemiology from hepatitis E genotype 1, HEV1, to hepatitis E genotype 4, HEV4, has been observed in northern China, marking a switch from human-to-human transmission to zoonosis. However, similar data from cities in southern China are lacking. This observational study of human hepatitis C cases in Shenzhen, a metropolitan city in the Pearl River Delta region, aimed to describe the clinical features and molecular epidemiology of hepatitis C in southern China. Over a 55-month period, we identified 20 patients with acute hepatitis C. Most were middle-aged men, and 50% of patients had concomitant liver disease, of whom 70% were identified to have non-alcoholic fatty liver disease. Such patients had a trend toward higher liver enzymes. Quantitative real-time RT-PCR using archived serum samples showed that 12 patients had hepatitis E viremia at presentation. Sequencing of the RNA-dependent RNA polymerase gene was performed for 5 of these patients, and phylogenetic analysis revealed that these 5 HEV isolates belonged to subgenotype 4b and were clustered with swine HEV isolates from southern China. Combined with other studies showing similar findings, this suggests that the molecular epidemiology of hepatitis C in China is evolving toward low-level endemicity driven by foodborne transmission from seafood or pork products. The importance of concomitant liver disease, in particular non-alcoholic fatty liver disease, as a risk factor for severe hepatitis C requires further study. Introduction. Hepatitis E virus, HEV, is estimated to cause 20 million infections worldwide annually. 1 Hepatitis C can cause fulminant hepatic failure and chronic infection in immunocompromised patients. 2 In China, hepatitis C has overtaken hepatitis A in terms of both incidence and mortality rates over the past decade. 3 This trend is driven by a combination of factors, increasing vaccination coverage against hepatitis A, improving sanitation, and an epidemiological shift in the transmission patterns of hepatitis E. 4 genotypes of hepatitis C have been commonly associated with human infection. Genotypes 1 and 2 are confined to human populations, whereas genotypes 3 and 4 circulate between swine and human populations. 4 Historically, most cases of hepatitis C in China in the 20th century have been caused by genotype 1 HEV, HEV1, which causes large waterborne outbreaks driven by person-to-person transmission. 5, 6 However, over the past 2 decades, HEV1 appears to have been replaced by genotype 4 HEV, HEV4, as the most common genotype causing human infection, 80% of cases, in northern China. 6 HEV4 is endemic in swine populations across China and is transmitted to humans who consume undercooked pork. This shift in molecular epidemiology has been well studied in northern and northeastern China. 7, 8 Although studies have documented the presence of HEV4 in pigs in southern China, 9, 10 there is a paucity of data on the epidemiology and clinical characteristics of human hepatitis C in this region. This is a significant shortcoming given the high population density of the heavily industrialized Pearl River Delta region of southern China. The objective of this study was to profile the molecular epidemiology and clinical characteristics of hepatitis C in Shenzhen, a southern Chinese metropolitan city with a large immigrant population from other parts of China. Using a phylogenetic analysis, we aim to test the hypothesis that zoonotic transmission is a common route of acquisition of hepatitis C in southern China.